One of the most frequently asked questions I get is about how to identify lameness or how to do a gait evaluation, particularly when it comes to thoracic limb lameness. So we're just going to go through a few slides and talk about some of my tips and tricks for gait analysis, specifically for the thoracic limb. So here are some of the first tips and tricks that I have. The first one is try to avoid slick floors. I mean, that's something that we talk about a lot here at CARE in general, even when it comes to management. But when you're doing a gait evaluation, you don't want the dog slipping and sliding around on the floors. They also may be reluctant to walk on the slick floors if they are, especially if they are arthritic or they have a hard time getting their grip on the floor. So in the hospital environment, if at all possible, try and walk on a rug or even outside. The other challenging thing about doing a gait evaluation in your clinic setting is that there's a lot of distractions. So whether it's other, sounds, other dogs around, other people around, and certainly other smells. And the smells can become quite distracting for certain dogs, even if you have them outside. So there are a lot of challenges about doing a gait evaluation in the clinic. Dogs are usually pretty, they've got their adrenaline going. They may be nervous, they may be excited, but no matter what, they often hide their lameness in as soon as you go to put that leash on and take them for a walk. So definitely trying to avoid slick floors, either walk them on carpet or outside, and really trying to avoid distractions as much as possible. Now, the next one is how to actually walk the dog. In a perfect scenario, you would have the owner, the dog handler, walk the dog on a loose lead using a collar. So no gentle leaders, no shoulder harnesses. Those are going to be restrictive and hard for you to evaluate the gait. Now, how many dogs don't pull on a leash and walk nicely along by their owner's side? Very, very few. So a more ideal scenario may be to have an assistant, a technician, walk the dog for you. Again, trying to use all of these same techniques, loose lead if possible, not having them pull away. Again, many dogs, especially in the hospital environment, are going to pull on the leash no matter who's walking them. So more ideally, if you have an opportunity or a space where you can watch the dog move around without the leash on, you can get a lot of information that way, either in your clinic. And so I do a lot of my gait evaluation just in either in our exam room or in a larger treatment area space. You can also get home videos from your clients and watch how they move around at home. We'll talk more about videos in just a second. But let's look at a couple of examples of, here's one of what not to do, right? So you can see this poor dog's nails gripping at the floor. My assistant here, she's demonstrating kind of what not to do, kind of pulling on the leash, dog's distracted by all sorts of things. Obviously not a very helpful gait analysis video. So don't do that. One more time, slipping and sliding all over the place. So better, we're gonna go outside, and assistant's walking on a loose leash, dog's walking towards us, not sniffing, not doing much of anything, but you probably picked up on a lameness in this dog, and we're gonna come back to this patient specifically and watch her walk a number of times. But if we watch this video again, a fairly subtle right front limb lameness, okay? Now, if we watch this same patient inside the exam room, same day, immediately after we came back inside from walking, took the leash off, much more evident right thoracic limb lameness, okay? So she's not amped up, she's not outside, not thinking that she's gonna either go for a walk or get in the car and go home. She's definitely demonstrating that right thoracic limb lameness here. Now, I will tell you this patient does have bilateral elbow arthritis, elbow dysplasia. She just happens to be worse on the right side, and that's what we can see here. So a couple more tips that are going to help you with your gait evaluation. So you want to watch the dog walk towards you, away from you, and from the side, if possible, you being on either side of the dog. And what you're looking for is when they walk towards you, you're mostly evaluating the thoracic limbs. When they walk away from you, mostly the pelvic limbs. When they walk from side to side, you're looking for how far they reach or extend that thoracic limb forward in the kind of cranial swing phase. How far do they extend that hip back in the caudal swing phase? One thing, you want to look at all of our different gaits. So walk, trot, and then potentially run, and unlikely that you're going to watch a gallop in the clinical setting, but you want to watch all different gaits, and then also look really closely for that transition between, say, the walk and the trot, or the trot and the run. Because this is an area where you may pick up on something that sometimes the clients will describe as a hitch in the gait. Sometimes this is when we will see dogs have some of those hopping or skipping nebulous lamenesses that we'll talk about in different section when we talk about pelvic limb lameness, but look really closely at that transition phase. And this is where slow motion videos can be really helpful to pick up between, is there anything that's awkward happening between those transition between the gaits? Another big tip is, especially when we're looking at thoracic limb, is to watch the dog walk in circles. And right when that dog comes out of a circle or out of a turn, they may display a more prominent lameness. And I do find that to be quite evident in dogs that have shoulder conditions. As they come out of a turn, depending on what's going on with them, they'll have a few more steps of more distinct lameness. Then if possible, evaluation of stairs. I don't have stairs in my practice or anywhere nearby, so I have to rely on client home videos if stairs are something that they're describing the dog has a problem with. Which brings us to the use of videos. If at all possible, if you're doing a gait evaluation, video the dog. Video, doing regular video, and then slow motion, because it can be really helpful in some of those less obvious lamenesses. And then if you can have a client show you home videos, again, when the dog is in their home environment, they don't have their adrenaline pumping, they're much more likely to display some of those lamenesses. So those last few tips and tricks really held true for any sort of gait analysis, whether you're looking for a thoracic limb or a pelvic limb lameness. Now, when we're looking specifically at the thoracic limb, what we're looking for is that down on the sound. What that means is we're saying our sound limb is our quote unquote good leg. That's the one that doesn't hurt. So imagine that the dog is, say, I'm painful in my right shoulder or my right elbow, and my left side is normal or, say, less painful. So I want to spend as little time as possible on my right side. So I'm going to go down. I'm going to spend more time, or I'm going to put more weight shifted to the sound or the good leg and offload that right one. So it's going to look like I'm going down on the better limb. The one that is opposite is the more affected limb. This is going to be best seen when the dog is coming towards you, when they're walking directly towards you. But now, what if a dog has bilateral forelimb lameness? What if they are equally affected from one limb to the other? Then honestly, you may not see that, that down on the sound or that head bob drastically or at all. And it means you're going to have to use some other parts of your gait evaluation and your physical exam to really figure out what's going on. But one thing that you can do is imagine that both limbs, we'll say both legs have significant arthritis in the elbows. With arthritis, we a lot of times will lose flexion of the elbow, or the dog doesn't like to fully flex. And compensating for elbow arthritis, the dogs often get tight in their shoulders. So what you may see on a gait evaluation is the dogs don't want to pick up their legs. They don't want to flex or bend at the elbow as much as normal would be. And you could look for this if they're stepping over. You can have them walk over curbs. The other thing that you may notice is they don't have as much of a swing phase cranially. They may have more shoulder restriction, and they have more of a short, choppy gait. So the last thing that I'll say is that it can be really valuable to watch dogs as, once they're not walking. We're talking all about gait evaluation here, but watch when they are standing, sitting, and then when they move through transitions, because you will also pick up on quite a few things there. So let's look at a few videos. So this is an example of a few things not to do, but also a good example when the dog comes out of the turn. So this is, the dog is pulling. So we're not really walking on the loose lead. There's a very big room here, so lots of distractions. I'll tell you that this dog did have ultrasound of both shoulders, so don't let the shaved area distract you. Pulling, not so good, not great for lameness evaluation. Right there, when he comes out of that turn, you can see that he was down on that right front limb, or down on the sound, meaning he was offloading the left leg. You can see it again right there as he sort of spins in circles. So don't use this video as an example of how to properly do a gait evaluation, but it does, you know, if you are faced with a situation like this, you can get some information out of it. One good thing about this room is it was carpeted, so we didn't have any slick floors to deal with here. Okay, so here's our black lab friend again, walking outside. And we've seen her walk again. You can now see a little bit more evident that down on the sound. So she's placing more weight on the left front and offloading the right pelvic limb. And you may remember this is the same dog we watched walk around with the leash off inside. So we do know that it is the right front limb. But let's take a closer look of this same dog walking in slow-mo. And again, we're looking for that down on the sound. So right there, down, putting much more weight on that left front limb. Head kind of bobs down and then up when she's on the right. So weight bearing more on the left, kind of hurts a little bit more on the right, shifts back to the left. And again, this dog does have bilateral elbow arthritis, but she is more severely affected on the right. And we can watch her also walk away from us. We're not going to get quite as much information, but I think you will notice the head bob a little bit as she's walking away. So yeah, you can sort of tell that she's bobbing on that left side, but if we watch it in slow motion, it's going to be, of course, a little bit more obvious. Even see her ears flapping there. So down on the left, a little bit higher up on the right. So down on the left and up on the right. Okay, lastly, we're going to watch her walk from the side. And so I would say that this part of the gait evaluation is a little bit harder. It's a little bit more subjective. And what my advice would be is get used to watching dogs what the normal gait looks like and what a normal cranial swing phase should be. And you know, just kind of describe or have an idea of what looks abnormal to you. I would say for this particular dog, it's not drastically abnormal. I think that she has a little bit of a shorter step or a little shorter cranial swing phase. We'll watch her walk one more time. Somewhat choppy gait there, but for this one, it's not quite as obvious as when she was walking towards us or away from us. And then lastly, as I mentioned, really looking at transitions and when dogs may be in a seated posture or even when they're laying down, especially if they go to lay down and they don't want to flex or bend their elbows all the way, or they kind of do a shuffle motion. I see that quite a bit in dogs that have more end-stage elbow arthritis. But this guy has, what you will see is quite an obvious right thoracic limb lameness. Even seated, he doesn't want to put weight on his right thoracic limb. And this dog actually, he has a pretty significant, quite obvious weight-bearing lameness. And I throw this, this video in here just at the end just to point out that this dog actually did not have osteoarthritis. He had a nerve sheath tumor. And I bring this up just because this degree of lameness and this degree of barely toe touching, barely weight-bearing, it's pretty uncommon for a dog with a shoulder tendinopathy or even a mild to moderate arthritis to have this degree of lameness. So if you see something that's this obvious, put on your investigative cap and think that while it could be OA, you have to make sure that it's not something more sinister. So there you go. There's some of my tips and tricks for gait analysis for the thoracic limb. I hope you found that valuable. This is just an example of some of the content and some of the new webinars that you'll find as part of the CARE Pro membership. Thanks again for your support.